The Washington County Wellness Initiative is this year's winner of the Community Champion Award.
One of the major things that we do as an organization is we identify the needs through community-based assessment, focus groups, community profile studies, and then we mobilize the partners to take action and do something about what was identified. So our ultimate goal is to improve our community's health.
The very first project, the Casa House.
Millie Capoletti, who's a very passionate Hispanic individual, was really one of those leaders identified that just naturally Hispanic folks would come to for help. And so Millie, through her leadership, really advocated for the development of her dream, which is a Spanish house. And through work with our local hospital, Jane Phillips Medical Center, Siemens Corporation, and ConocoPhillips, and the Washington County Health Department, we were able to have our first project, which was Casa Hispana.
Hi, my name is Millie Capoletti. I'm the director of the Hispanic Outreach Center here in Banksville, Oklahoma. We opened our doors 10 years ago. Our mission is to help the Hispanic integrate in our community. At the same time, we help all the agencies that needs to work with the Hispanic and they don't speak the language. We do everything from A to Z, whatever they need.
From there, expansion to another 10 work groups to address community-identified health concerns.
Well, I represent the Access to Healthcare work group, and our position is to get people into healthcare facilities, someplace that they can call their medical home. So we want to get people into a medical home and have their needs taken care of, assessed and taken care of. And hopefully that will prevent some of the big problems we have later with people needing the emergency room, needing to go into the hospital, and large medical costs later. So prevention is the way to go.
The umbrella is a listing of work groups under the Wellness Initiative and is overseen by a board of directors.
When we asked those 5 community health priority areas, what are the top 5 things you want to work on? Transportation was identified by every single one of those work groups as the most critical community need. Without transportation, it would make it difficult for individuals to access needed services. So there was a transportation coalition developed.
Well, I'm Father Lee Stevens. I'm the rector at St. Luke's Episcopal Church and have been involved with the Transportation Coalition for many years now, trying to find a way to meet the needs of people who lack transportation. Every social agency, every benevolent agency, everyone in town has said the number one need is transportation in Bartlesville. But for the last 4 years, we've had a pilot program with a flexible fixed route, I think is what it's called, transportation system with one bus, making a 1-hour circuit, and it's been very, very successful, very well received. Now we're looking at ways to expand that.
And then we discovered that suicide was a leading cause of death in our county for young adults 25 to 34. So we needed to respond to that, and we developed a suicide prevention coalition.
For 41,000 people died by suicide in 2013. And it doesn't look like anything's going to change quickly. We must come together and work to break through the stigma and to provide the help for those who are suffering.
A lack of affordable housing and unhealthy housing were all issues that had a big impact too. So we developed an affordable housing coalition.
We have a day center where the families will come during the day. They will shower, we will help them look for jobs, we will help them with transportation, housing, driver's license, GED, whatever the goal may be. Then we have 12 churches that are host congregations, so the families will go to the churches in the evening. The church will serve them a meal. We will repeat this process. They'll come back to the day center, and we kind of do this process until we can get them self-sufficient and on their feet. The beds, well, what you see here is the beds that were purchased for the Family Promise program. These are the cots that will go to the churches where the children and families will stay for the night.
These are just some of the 11 projects successfully being operated in Washington County and made possible through several funding sources, including the HRSA Network Planning Grant.
And so you can see how community individuals that were very passionate about these issues, our role was to help them come together, which basically led us up to the HRSA Network Planning Grant. So we had, at this time, 11 initiatives, including poverty. We developed a Bridges Out of Poverty program, and we have a Family Promise program that responds to the needs of homeless children and their families. And so all of these things needed help and support. And we were very fortunate to be able to receive a HRSA Planning Grant, which helped to begin to pull all of these networks together to be able to solidify them and to provide the infrastructure they needed to be able to accomplish the goals that they had set for we call them work groups.
Congratulations to the Washington County Wellness Initiative as this year's winner of the 2015 Community Champion Award.